Hey, this is Dr. Goodwin, your cardiology concierge, coming to you once again, trying to answer some of these questions that keep moms and dads up at night. One of those big things that keeps you up at night is your puppy coughing. Why, oh why, is my dog coughing nonstop? You know, there's a few hundred different reasons why they could be coughing, but some big ones, especially in the cardiology realm, are one, if fluid is starting to build up in your dog's lungs. Two, if we're starting to get a heart that's bigger than it should be pressing into our windpipe. Or three, our windpipe itself is starting to kind of fold in on itself. So what do I mean by all that? All right, so let's take the first one. If your baby is actually starting to build up fluid in his lungs, that means it looks like we're starting to develop a thing we call congestive heart failure, or CHF. Not a good thing. How do we know that the cough we're hearing is associated with CHF, or congestive heart failure? One huge big test. We actually count the sleeping breathing rate. Not the waking, not the running, not the after coughing, but when the pup is sleeping. You wait till they're asleep and you watch them and they're out there snoozing and you get, that's one breath. In and out, that's two. That's three. And we just count those for a minute. We see how many breaths are taken in a minute. As long as it's under 40 breaths per minute, it's not very likely that you're dealing with congestive heart failure, which is great. So then, in that case, the majority of the cough that we really see comes from either A, the heart being enlarged and pressing into our windpipe, or B, our windpipe itself folding in on itself. So I think the one that gets the most confusing is the windpipe folding in on itself. Your windpipe, or they fancy name for it, they call it the trachea. That's the one where you can feel the little rings in there. The trachea is made up of 2/3 cartilage, so kind of like a U shape of cartilage, followed by a little band of tissue that goes across the top. Why is that important? Well, in a lot of dog breeds, as they get older, that cartilage portion of the trachea will start to get soft. As it gets soft, it starts to fold in on itself. When it folds in, then your trachea might end up touching another portion of your trachea. Why is that a big deal? Think of it this way. Has anyone drank some water and swallowed down the wrong pipe? You know how you're coughing for the next 5 minutes and you can't stop, and it's just that trying to get that tickle? That's what we see with a lot of these animals, especially a lot of dogs. Your Pomeranians, your Yorkies are probably the top two, but you get it with many of your small dogs, your Poodles and your Chihuahuas and Shih Tzus and Pekingese. These guys will get this irritation going because they feel their trachea touching itself, and it creates this tickle, and they try to get that little cough out. When they feel that trachea kind of fold in and get them, it gives them the like they're going to cough up something, but nothing ever comes out, or maybe a little spit. But it's because the trachea is folding in, it creates a tickle. And that cough is more a way to kind of scratch that itch or address that tickle. Little dogs have the cough. You get a big dog, they tend to do same kind of thing. But typically this is going to happen when there's irritation in the trachea. A lot of your big dogs will do it more often if the heart's actually enlarged. And that enlargement will cause that cough most often after they lay down. Why after they lay down? Because when they lay down, the force of the ground presses into their chest, which lifts their heart up and makes their heart start to press into that windpipe or trachea that runs right above your heart. With that pressure there, they feel it, and it's almost like your tie is too tight, and and they try to scratch that itch by making that coughing sound. So just because you have the cough doesn't mean it's heart failure. There's a number of things that can set you off to cause that. This is Dr. Goodwin, your cardiology concierge, asking you once again to stop by anytime. Hit that like or subscribe button that's in the ethereal space, and we'll catch up with you soon.